Is this person brain dead? Well, not so fast. You can't just decide someone is brain dead because their brain looks like this. In fact, there are very specific criteria that doctors use to determine if someone is brain dead. And even then, it's still not 100% accurate. First, the patient has to have a complete loss of brain function. This means they're totally unresponsive to anything. They don't move their limbs. They don't make any sounds. And when doctors test their reflexes, they get no response. But even if the patient does all of those things, it doesn't automatically mean that they're brain dead, because sometimes people who appear to be brain dead actually aren't. Now, doctors used to be able to pronounce someone dead based on a clinical diagnosis alone. However, because of the fear of making a misdiagnosis, we now require the brain scan in order to confirm brain death. If you don't meet all three, then you don't have brain death. It's that simple. They use a test called the apnea test, where they remove the patient from life support, see if they can breathe on their own. If they can't, then they're considered brain dead. So what do doctors do in these cases? There are three main criteria to diagnose brain death. The first one is clinical, so that means you have to have a certain set of symptoms. The second one is a test called a cranial nerve test, and the third one is a brain scan called a cerebral angiogram. Now, in order to have brain death, you need to meet all three of these criteria. If there's no blood flow in the brain, then you have brain death. The truth is, brain death is extremely rare. I've never actually seen a case of true brain death in my entire medical training. The brain scan is called a cerebral angiogram. It's a special type of MRI that looks at the blood flow in the brain.